Is your ability to get a firm erection becoming more challenging these days? Are you finding that things just don't work the way they used to, leaving you feeling frustrated? Perhaps even a little bit alone with the problem. It's a reality many men face as they get older, and it can impact your confidence and your relationship. There is often a painful gap between what you want to happen and what actually does. We look for medical reasons, lifestyle factors, and yes, those are incredibly important. But sometimes the issue stems from a very private, often overlooked habit. As a surgeon who specializes in male anatomy and function, specifically dealing with issues of the penis, I see many men struggling with erectile difficulties, while causes like heart disease, diabetes, nerve problems, and hormonal changes are certainly significant. There's a surprisingly common contributor that most men never suspect. It's a mistake many make during masturbation, a habit practiced in private, thinking it's harmless or even helpful, when in fact, it can be silently undermining your ability to achieve and maintain an erection during partnered intimacy. It's not talked about much, and most men wouldn't even think to bring it up with a doctor, but it's a real phenomenon, and understanding it is the first step to overcoming it. In this video, I want to pull back the curtain on this specific mistake. We're going to talk openly but respectfully about how certain habits you might have developed over the years, perhaps without even realizing it, could be making it harder for you to get and keep an erection when you're with a partner. We'll explore the physiology behind it and, more importantly, discuss practical, actionable steps you can take to reverse the trend and improve your erectile function. This isn't about judgment. It's about information and empowerment. Watch to the end for something that will surprise you about just how common this is and how effectively you can address it. Let's dive into the first aspect of this often unrecognized issue. The core problem I frequently encounter isn't masturbation itself, which is a healthy, natural activity, but rather how it's done, particularly the specific techniques that men might gravitate towards over many years. Think about it. For decades, you might have developed a very consistent, very specific way of stimulating yourself. This might involve a particular grip, a certain amount of pressure, or a particular rhythm, and crucially, it often involves simulating a level of friction and stimulation that is very difficult, if not impossible, to replicate consistently during partnered sex. Let me explain what I mean from a physiological standpoint. Your penis, and specifically its ability to get and maintain an erection, relies on a complex interplay of nerve signals, blood flow, and muscle relaxation. The nerves in the penis are responsible for sending signals to the brain that trigger the cascade of events leading to an erection. The widening of blood vessels, the inflow of blood, and the trapping of that blood within the erectile tissues. These nerves become accustomed to a certain level and type of stimulation to reach the point where they signal for a full erection. Now, imagine if for years, perhaps even decades, your primary method of stimulation involves a very tight grip, applying significant pressure, or using a surface or lubricant that creates an intense, perhaps even slightly rough, sensation. Your nervous system, over time, can become conditioned to require this high level of specific stimulation to respond fully. It's like turning up the volume on your internal sensitivity dial so high that only the loudest signal gets through effectively. When you then try to engage in partnered sexual activity, the natural stimulation from a partner's body, while potentially more intimate and emotionally fulfilling, often involves less localized pressure, a different kind of friction, and varying levels of intensity. If your nervous system has become accustomed to that much higher bar set by your specific masturbation technique, the stimulation from a partner might simply feel insufficient. The signals aren't strong enough to trigger a full, sustained erection in the way they used to. It's not that you're not aroused or attracted to your partner. It's that your body has been trained to respond maximally only to a very specific, often overly intense, type of touch. I've seen many patients who describe this frustration. They might say they can get an erection perfectly fine on their own, but it's difficult or impossible to maintain it during intercourse. Or they might find that the sensation during sex just isn't intense enough to bring them to climax, even if they can achieve some degree of hardness. This disconnect can be incredibly disheartening and lead to performance anxiety, which only makes the problem worse. The actionable step here. The first key change involves consciously modifying your masturbation technique. The goal is to lower that threshold of required stimulation back down to a level that is more in line with what is typical during partnered sex. This often means reducing the pressure you use. Try to use a lighter grip. Experiment with different techniques that mimic the sensation of natural movement and less concentrated friction. Perhaps use less lubricant. Or a different type, to allow for a more natural feel. This isn't about stopping masturbation altogether. Far from it. It's about retraining your nervous system. It's about teaching your body that it doesn't need that extreme level of pressure or specific friction to respond. Think of it as recalibrating your sensitivity. It takes patience and conscious effort. You might find that initially, using less pressure feels less intense or less satisfying. That's expected. You're trying to change a long-standing habit and retrain neurological pathways. Try incorporating different hand positions, varying the speed and rhythm, and focusing more on the sensations throughout the entire shaft of the penis, rather than just a specific spot. If you typically use a very tight grip around the base, try focusing on a lighter touch near the head. If you always use one hand, try two. If you always use a lot of lubricant, try less or none. The aim is to make your solo practice less specific and less intensely pressurized than it might have been, moving it closer to the kind of stimulation you would experience during intimacy with a partner. This initial step, adjusting the technique and specifically reducing pressure, is fundamental. It's about breaking the decades-long conditioning that your nerves might have undergone. It requires mindfulness during what might have become a routine, almost automatic activity. Be patient with yourself. This isn't an overnight fix. It's a process of re-education for your body. By consciously changing the way you stimulate yourself when alone, you start to broaden the range of stimuli your penis and nervous system respond to effectively. This lays the groundwork for the next crucial steps in addressing this issue, which involve frequency and variety. So, having talked about the technique of masturbation and how excessive pressure or a specific grip can desensitize the penis to normal stimulation, let's move on to another critical aspect that many men over 60 overlook: the frequency and speed of their solo activities, and how these habits create unrealistic expectations for partnered sex. It's not just about how hard you grip, it's also about how often, how quickly, and the singular focus this creates. Think about the typical pattern. For many men, especially as they get older and perhaps opportunities for partnered sex decrease, masturbation can become a very regular, even daily, occurrence. There's nothing inherently wrong with this frequency from a health perspective, but combined with the high-pressure technique we just discussed, it can exacerbate the problem. If your body is constantly being trained with intense, rapid stimulation, it further reinforces that high threshold for response. It's like always sprinting instead of learning to jog or walk at a comfortable pace. Your system gets used to the high-intensity burst and struggles with sustained, moderate activity. Furthermore, solo sex often involves a very specific, often rapid, build-up to climax. You know exactly what feels good, and you can focus solely on achieving that peak sensation efficiently. This is very different from partnered intimacy, which involves another person's body, their movements, their desires, and often a much slower, more varied pace. Intercourse naturally involves pauses, changes in angle and depth, and moments that aren't purely about reaching orgasm as quickly as possible. It's about connection, shared pleasure, and intimacy, which includes, but isn't solely focused on, the physical mechanics of getting hard and reaching climax, when your body is primarily conditioned by rapid, focused, solo sessions. It can develop a sort of speed dependency or a need for that singular, direct pathway to orgasm. This can make the more nuanced, less predictable stimulation of partnered sex feel frustratingly slow or ineffective at triggering or sustaining an erection. Your brain and body have learned to expect and respond best to that direct, rapid path, and the winding, shared road of intimacy doesn't provide the same quick-fix signals. The second set of actionable steps involves addressing this frequency and speed dynamic. It doesn't necessarily mean stopping masturbation, but perhaps reducing its frequency if it's daily or multiple times a day. Allowing your nervous system some time to reset and become more responsive to different levels of stimulation. Even taking a break for a few days or a week can sometimes make a noticeable difference in sensitivity. More importantly, it's about consciously changing the pace and focus when you are alone. Try practicing slower, more deliberate masturbation, instead of rushing to orgasm. Spend time exploring different sensations on your penis with varying degrees of light touch, focusing on arousal itself rather than just the mechanics of achieving erection and climax. Use lighter strokes, vary the pressure even within a single session, and incorporate different parts of your hand. Think of it as expanding your penis's repertoire of responsive sensations. Right now, it might only be playing one note really well, the loud, fast one. You want it to learn to appreciate and respond to a wider range of notes and rhythms. This slower, more explorative approach during solo time can help retrain your nervous system to be more receptive to the types of sensations you'll experience during partnered sex. Another aspect within this section is the exclusivity of manual stimulation. If your solo habit only involves manual stimulation with a tight grip, your penis might become less responsive to other types of touch or friction. Try incorporating different textures if you're comfortable doing so. A soft cloth, a silk scarf. Experimenting with lotions, not just lubricants, to see how different glides feel. The idea is to introduce variety and broaden the range of stimuli your body associates with pleasure and arousal. Many men find it helpful to practice what's sometimes called sensate focus techniques during solo time, similar to what might be recommended for couples. This involves touching yourself without the goal of orgasm, simply focusing on the sensations and exploring what feels pleasurable at a lower level of intensity. This helps decouple arousal and pleasure from the immediate need for a full erection and rapid climax, which can be incredibly beneficial for improving your experience during partnered sex. Remember, the goal here is not to diminish your solo pleasure, but to make your body more versatile and responsive to the kind of natural, varied stimulation that happens during intimacy with a partner. By reducing the reliance on extreme pressure, high speed, and a single technique, you are essentially lowering the bar for what your nervous system needs to signal for an erection and maintain it. This takes practice, patience, and a willingness to experiment. It might feel awkward or less immediately satisfying at first, but the long-term goal is to improve your sexual experience with your partner, which is often the deeper desire for men facing these challenges. Adjusting your technique, pace, and introducing variety during your solo moments are powerful steps toward achieving that goal. So, we've discussed how specific, high-pressure techniques and the speed and frequency of solo practice can condition your body to require a very specific, often hard-to-replicate level of stimulation to achieve and maintain an erection. Now, let's put it all together and talk about what you can do practically and consistently to reverse this trend and improve your ability to get and keep an erection during partnered intimacy. This isn't just about understanding the problem. It's about making conscious choices to change long-standing habits. First and foremost, acknowledge this isn't about blame or shame. This is a common physiological response to a very common behavior. Your body has simply adapted to the signals it's received most consistently over a long period. The good news is, the body is adaptable, and you can retrain it. It requires patience and a willingness to experiment with different approaches. The overarching principle is to deliberately make your solo activity less like what you've always done and more varied and lower intensity. As we discussed, start by consciously reducing the pressure you use instead of a tight grip. Try a looser hold. Use the flat of your hand, or even the back of your hand, instead of a closed fist. Explore how different parts of your hand and fingers feel with different levels of pressure. The aim is to reduce that focused, intense friction that overstimulates a specific area and desensitizes the rest. Secondly, focus on slowing things down. Deliberately take longer during your solo sessions. Spend time exploring sensations at lower levels of arousal without the immediate goal of climax. Practice staying at a point of high arousal without pushing over the edge. This helps build your capacity to sustain arousal and erection without the need for a rapid buildup and quick release. This is particularly beneficial for intercourse, which often requires sustained erection over a longer period with varying levels of stimulation. Thirdly, introduce variety. If you always use the same hand, try the other hand. If you always use a lubricant, try some sessions without it, or with a different type. Experiment with different positions. The more varied the stimulation you introduce during solo time, the more adaptable your nervous system will become to the different types of touch and movement you'll experience with a partner. This helps break the reliance on that single, specific pathway to arousal and erection. Think of these changes as physical therapy for your penis and nervous system, just like you wouldn't expect to regain full mobility after an injury overnight. Retraining your erectile response takes time and consistent effort. Don't get discouraged if you don't see results immediately. Keep practicing these new habits. Beyond just technique, consider the mental aspect. Often, performance anxiety creeps in when you've had difficulty achieving or maintaining an erection with a partner. This anxiety itself can be a major barrier to getting hard. By addressing the physical conditioning through these new solo habits, you can start to rebuild confidence in your body's ability to respond. As you notice improvements in sensitivity or the ability to maintain arousal with less intense stimulation during solo practice, this can positively impact your mindset during partnered sex. Another surprising element that often helps is focusing on intimacy and connection with your partner outside of the bedroom, reducing the pressure and anxiety around intercourse itself by prioritizing cuddling, kissing, massage, and other forms of physical intimacy can paradoxically make it easier to achieve an erection when you do attempt intercourse. It shifts the focus from performance to pleasure and connection, which is a much more fertile ground for natural arousal. Remember, this isn't just about achieving a rigid erection. It's about improving your overall sexual health and satisfaction, both solo and with a partner. By making these adjustments to your private habits, you are working to make your body more responsive, your experience more varied, and ultimately, your intimate moments with your partner more fulfilling. It's a journey of rediscovery and recalibration. So, to recap naturally, we've talked about how the long-term habit of using excessive pressure or a very specific technique during solo activity can make your nervous system less responsive to the natural, less intense stimulation of partnered sex. We also discussed how the speed and frequency of solo sessions can create an expectation for rapid arousal that doesn't match the pace of intimacy. The key to addressing this involves consciously reducing pressure, slowing things down, and introducing variety in your solo practice to retrain your body's response. This issue is far more common than you might think among men over a certain age. Many men experience it but feel too embarrassed to talk about it. Understanding that it's a physiological conditioning problem, not a fundamental flaw, can be incredibly liberating. Small changes, consistently applied, really can make a big difference in your ability to respond naturally to your partner and enjoy intimacy more fully. Be patient, be persistent, and be kind to yourself throughout this process. Your body has learned a habit, and it can learn new ones. I hope this open and honest discussion has been helpful for you. It takes courage to confront these kinds of personal habits, but taking steps to address them can significantly improve your quality of life and your relationship. If you found this information valuable, I encourage you to share your thoughts or perhaps your own experiences, anonymously if you prefer, in the comments below. Hearing from others can be incredibly reassuring. And if you'd like to see more videos discussing men's health topics with practical, actionable advice, please give this video a thumbs up and subscribe to the channel. Taking care of your health, including your sexual health, is key to living your best life at every age.